Friends of the media, good morning. Thank you for coming to the press briefing. In a moment, the Chief Executive will say some words and then they should take questions from the floor. Please keep your distance during the epidemic. Now I'll invite the Chief Executive to speak. Friends of the media, members of the public. Together with the Secretary for Food and Health, the Chief Executive of the Hospital Authority, the Secretary for Labour and Welfare, I'm here to give you the latest update on our anti-epidemic effort. I formally launched an enhanced version of information of news communication. Now, apart from Tuesday, where we have the Executive Council meetings, every day I, together with the relevant principal officials, will be giving you an account on the progress of our work. At this press conference, this will be the forum for us to clarify any rumors and give a more authoritative version of events and facts. This is also the opportunity for us, for you to ask questions about our anti-epidemic effort and strategy. The 4:30 press briefing will continue to be held by the Center for Health Protection and the Hospital Authority, so their representatives to give you an update on the epidemic situation and also patient admission to hospitals and so on. Now, I just launched the high-level press conference. This will continue until we prevail over this wave of the epidemic. I could announce that tomorrow, together with the Secretary for Development and the Secretary for Security, we will give an update on the construction of isolation facilities, their management, and so on, with the support of the central authorities. And of course with their assistance too. And of course at this forum you could ask questions of the greatest concern to the public and also learn about the latest update and progress. Now today I would like to give an account on a very important issue. That is how we could enhance the treatment protocols for COVID-19 patients, in particular how we could protect the elderly. Since the start of the fifth wave, we have over 500,000 positive cases. Omicron is highly transmissible and is spreading really quickly, and that's really alarming. But then people usually have relatively mild symptoms. With the figures announced by the Center for Health Protection, as I mentioned, there are some 500,000 positive cases. For at least 100,000 cases, the patients are asymptomatic. That's because vaccination over the past period has helped to effectively reduce the number of serious cases and death cases. But then, unfortunately, in the fifth wave of the epidemic, we have seen a surge in fatalities. As at yesterday, the 8th of March, in this wave of the epidemic, there's a total of 2,365 death cases. So some 2,000 people passed away. This is really sad. And many of these of the deceased were the elderly. The median age is over 80 years old. Many of them have underlying conditions, and more than half of them stayed at residential care homes for the elderly. But we must spare no effort in protecting the lives of the elderly. We also want to enhance their health condition. So we have taken on the advice given by mainland experts. In particular, Professor Liang Wannian has been in Hong Kong for over a week, and he has been working non-stop to help us. And so at this point, our focus should be on reducing severe cases, death, and the spread of the disease. So we need to expand the capacity of hospitals to treat COVID-19 patients. We want to put infected patients in hospitals centrally, and we need to focus our resources in saving patients and preventing the condition from deteriorating into severe or even critical cases, and we're still to prevent them from death. So we together with the hospital authority will take the following measures. Firstly, for the Queen Elizabeth Hospital, it will be turned into a designated hospital for the treatment of COVID-19. In the next 4 days, we will strive to transfer non-COVID-19 patients who are now in the Queen Elizabeth Hospital to other hospitals. In other words, starting from today, the Queen Elizabeth Hospital will no longer admit non-COVID-19 patients. The Fire Services Department will be giving full support in this transfer exercise for patients to go to other hospitals and for patients at the Accident and Emergency Department to go to other hospitals. And then for the North Lantau Hospital and the Tin Shui Wai Hospital have been converted into COVID-19 hospitals with some 900 beds. And then soon, about half of the general ward beds, convalescence beds, and so on, will be turned into COVID-19 beds. This is a major exercise that involves about 9,000 beds. Of course, we would like to have the support and cooperation of private hospitals too, so they could take on some of the patients from the hospital authority. That's the second measure. The third measure is that I have put a request to the central authorities to send us medical teams so that we could enhance our capacity to handle severe cases. We could enhance our facilities at 2 locations. That is the North Lantau Infection Control Center, and also there's a temporary hospital with 800 plus negative pressure beds. That's the North Lantau facility, and then we're also talking about the Asia World Expo facilities. So here, we could have enhanced capacity to deal with severe cases. The fourth measure is that there's going to be emergency hospital to be built by the main authorities for us in Lok Ma Chau Loop, and it will be supported by mainland medical staff. We hope that these facilities will be commissioned in phases starting from April. All these facilities together could substantially enhance our capacity as public hospitals to treat COVID patients, so that we could prevent patients from becoming severe cases because of insufficient care and treatment. Now, with these facilities that I mentioned, we will be able to provide about 16,000 COVID-19 beds. But then if the epidemic remains at this high level, then we cannot achieve what Professor Liang Wannian said, that we should have beds ready for patients. So then we need triaging and treatment for different groups of patients, including the elderly. Here we are talking about a number of measures. Firstly, we're going to set up more isolation and occasional care facilities in the community for the elderly. For elderly patients whose condition has stabilized or whose condition is mild, they could go to these facilities and recover under medical supervision. Otherwise, their conditions may vary, and then if they go back to the residential care homes, then their condition may take a turn for the worse all of a sudden. So for these isolation and occasional care facilities in the community for the elderly patients, they are to be operated by the Social Welfare Department. At the Asia World Expo, there are over 1,000 beds already in operation, and then there are 2 indoor games halls that have been converted into occasional care facilities. At that is the Choi Wan Road Sports Stadium and the Shakib May Sports Stadium. Now, when we have trained enough staff, there will be other facilities to come into operation at the Kai Tak Cruise Terminal. There will be 1,200 beds for isolation and occasional care purpose. And then we have 7 other indoor games halls which could be converted in the same way to become isolation and occasional care facilities in a community. But then what we lack most is that as each of these occasional care centers, we need to have sufficient health care staff and carers. That's why I have asked private hospitals to give us assistance. In terms of carers, we are taking a parallel approach. On the one hand, we are trying our best to enhance the incentives to recruit more local carers. At the same time, we're going to import carers from the mainland. The second specific measure is to give more support to residential care homes for the elderly and the disabled, RCHEs and RCHDs. For some of these homes, we're going to provide closed-loop management. That means there will be dedicated hotels and transportation. So carers and workers taking care of the elderly would work in a closed-loop arrangement. They don't need to go back home or go into the community, and then they may get infected and then they bring the disease back to the homes. We don't want that. So, of course, we would first focus on homes without infection yet to start with this closed-loop approach. We don't have much time left, but these homes will have the priority for us to implement closed-loop management and enhanced protection for these homes. And then we need to protect sufficient personal protective equipment and masks for the workers. And then third measure, we hope that within 2 weeks, that is before the 18th of March, because we mentioned that a few days ago. So before the 18th of March, we will complete vaccination for all residents in these care homes in Hong Kong, and I mean the completion of the first dose. And then the fourth measure is that for elderly patients with mild symptoms, we will provide isolation at home, and then there will be an enhanced COVID-19 pack with rapid test kits, proprietary Chinese medicine, thermometers, and so on. And then we will take the initiative. In other words, we don't need the elderly to call us. There will be healthcare workers calling these elderly isolating at home to ask about their health condition so they could do clinical assessment or remote consultation. So for elderly in home isolation, there will be a dedicated hotline for them. And then the third point is, now if these elderly patients need to see a doctor in this remote consultation, they will be given priority because the hospital authority now has 17 designated COVID clinic. They could get priority appointments, and they could book our dedicated transport to go to these clinics. And if at the clinic it's found that there are signs of the condition deteriorating for these elderly patients in home isolation, they will be sent to hospital at once for a treatment.
Medication is most important when it comes to prevention of serious cases. I'm happy to announce that after concerted efforts from various parties, the hospital authority has purchased enough oral agents for fighting COVID. One is being used and the other will arrive in Hong Kong next week. I'm most grateful to these two drug manufacturers, i.e. Pfizer and MSD, for their efforts for the benefit of Hong Kong. So the two oral agents against COVID will arrive at Hong Kong very soon. And of course, in every aspect of our work, including the conversion of Queen Elizabeth Hospital to a dedicated hospital for COVID, are bound to impact on our community. I appeal to everyone in Hong Kong to stand united, to collaborate with the government in various measures, including maintaining our social distancing measures to prevent infection, and we need to have more community isolation facilities. For the confirmed cases, please move in into CIFs according to our allocation and placement so as to reduce the risk of spreading the disease to their family members and to members of the public. Now, I'm sure we can triumph in this war against the pandemic. Now, I will invite Dr. Ko to brief us on the details on conversion of QEH to a designated COVID hospital. And then I and the secretaries will take questions from the floor. Dr. Ko. Thank you, CE. I'd like to now brief you on the arrangements for turning QEH into a COVID-dedicated hospital. Starting from today, we are going to in phases transfer non-COVID patients that are suitable for transfer to other hospitals so that we can vacate more beds to admit COVID patients so that we can be a comprehensive designated hospital for COVID patients. We expect that about 380 odd patients will have to be transferred to other hospitals, and some can be discharged. Among these 380 odd patients, about 250 of them will have to be transferred to other hospitals. About 130 of them can gradually be discharged because after our assessment, these patients are recovering. With the exception of a very small number of patients whose clinical conditions are not suitable for transfer will be dealt with in the way I just mentioned. Most of the patients will be transferred to hospitals within the Kowloon Central Cluster. In fact, the other 6 clusters of HA will help out. And where appropriate, some patients will be transferred to private hospitals. The transfer of patients will be done by our non-emergency ambulances of HA. The auxiliary medical team and also the St. John's ambulance will also help us in this exercise. Starting from today, the transfer of patients will be completed in 3 to 4 days. Non-COVID patients will be transferred from QEH to other hospitals, and we'll have to stop admitting new patients so that QEH can become a major comprehensive designated hospital for COVID patients. So there will be a special arrangement for our A&E department. Starting from today, except for life-threatening cases with life-threatening conditions, other cases will be transferred to other A&E departments. So our A&E department in QEH will mainly take care of COVID patients. For patients suffering from trauma, they'll be supported by other trauma centers in PWH and QMH. We believe by the 13th of March, that is the early morning of Sunday, we would have completed the transfer and of patients and reallocation of A&E department patients. And then we will have about 1,500 beds available for COVID patients. Through this arrangement, I hope we can concentrate our COVID patients in a hospital. We can pool our resources and experts together to provide necessary treatment to patients to reduce fatality and serious conditions. We do understand that patients would be affected in this transfer exercise. The hospital will communicate with patients and their family members, hoping to minimize the disruption. We understand that there may be inconvenience caused to patients. We ask for their understanding and please cooperate with our medical staff. Through this arrangement, I hope we can boost our capacity to treat COVID patients so that we can achieve our objectives of reducing fatalities and serious cases. Question time. Please raise your hands and please identify the agency you represent and please use our microphone. That gentleman in the front. Good morning. See, I am from CCTV. Given the serious condition of the epidemic, the central authority has asked the SL government to be mainly responsible. So will the government readjust its mindset? Are there new measures being contemplated? Now, mainland experts have arrived in Hong Kong. In what areas have you exchanged views and also sharing of experience, and what directions have been given by the expert? Thank you very much. Starting from January 2020, we have been fighting this COVID epidemic, and the SL government has shouldered the main responsibility. So we very rapidly raised our contingency mechanism to highest level, the highest of our three-tier system. So the most senior command center has been under my instruction, and 121 such meetings have been held to assign work and to ask for departments to follow up. 3 principal directors and also other secretaries of bureau have to attend this meeting. But sometimes we do not have sufficient capacity and capability. In 2020, in the later half of 2020, when we had the third and the fourth wave, we were boosted by the central authorities. Over 500 testing personnel from Guangdong, Western Guangdong, and Guangxi came to Hong Kong for our universal testing, and they also helped us to build the North Lantau Infection Control Center. We're most grateful for that. However, for this wave, the numbers of cases are multiplying, and that has exceeded our capability. And since the Lunar New Year, the epidemic has been very serious, and we've asked the central government for our support. Now it's been a month, and I can say that the central government has responded to every request from us, and in many ways, the support they've given us have far exceeded our requests. For instance, we asked for medical supplies, but we did not know that there was a very effective Chinese proprietary medicine that can help to control the disease. So the central authorities has, out of its own initiative, donated 3 brands of Chinese proprietary medicine to us, and they are well received by the public. So we have procured these medicines for the public. So for our support to the elderly persons to be isolated at home, we will have this medicine included in the resource kit, and we welcome telemedicine to be provided by Chinese medical practitioners. As for the question of main responsibility and our strategy in fighting the epidemic, we've never changed. It's just because of changes in the epidemic situation that we have to keep adjusting our measures. Now, before the 5th wave, we insisted on using nasal swab and for PCR tests because it is the most sensitive case and what we call a golden standard. But then we have hundreds of thousands of people waiting to be tested. If we insist on this golden standard, then I'm afraid we won't be able to cope. Besides, RAT has been well recognized because of technological advancements. So we encourage members of the public to use RAT kits, and there will not be follow-up PCR test, because if we have to confirm with a PCR test, we won't be able to cope. So yes, 2 days ago we launched this online platform. People tested positive when RAT kit can upload information to the system. So the SL government showed us the main responsibility, and our strategy is to have the best interests of the community in mind to ensure the safety and also health of our community. But then we have to make adjustments. People may say that we have been swelling, but then I think that depends on your viewpoint. We must make good use of our resources and also the support from the central government to achieve the best results. As for a visit from mainland experts, well, in early February, this is one of the very important requests among the 5 I made to the central authorities. We have fought SARS, and after that also the swine flu and also avian flu, but those were of a much smaller scale. The mainland is very experienced in fighting COVID, and in the last 2 years we have seen outbreaks in cities in the mainland, and so I requested the central authorities to give us expert guidance. But so far, 3 batches of experts have come to Hong Kong. Many of them are still in Hong Kong, so this has far exceeded our expectations. So they have stayed here for a few days. Well, on the 28th of February, Professor Liang Wannian led a team of experts to Hong Kong. And as we all know, Professor Liang is the leader of NHC's COVID response expert team. So Professor Liang has been visiting different places in Hong Kong, and Professor Chen can supplement. On the 4th of March, I met with Professor Liang and his team. We had more than a 2-hour discussion. Now, these are not just protocol meetings. Rather, I listened in depth to their observations and their views. I can share with you what Professor Liang said on the day we met. Now, of course, he stressed that the SL government should shoulder the main responsibility. At the request of, or at the demand of the central authorities, they came to Hong Kong to discuss with us and to assist us in making decisions. Professor Liang told me that after his few days visits in Hong Kong, he was very impressed. I remember his mentioning this to the media. He was impressed in 3 ways. First, the SL government and relevant departments attach a lot of significance to the control of the epidemic. In the past 4 waves of outbreak, we were successful in controlling the spread, but then the 5th wave is now raging, and the SL government has taken various measures to contain this wave, but the situation has far exceeded our capability. And he was very impressed that different departments and their frontline workers were working very hard. Experts from different areas took the initiative to provide suggestions to the government. So he has the feeling that we are in a very strong fighting spirit against the epidemic. And he told me he was impressed when he was traveling in a car around the community. He saw how cooperative Hong Kong citizens were. We all wear masks, and we comply with the social distancing measures. So he is very confident that we're in a very good position to win the epidemic. Of course, he saw some shortcomings. And for instance, we don't have a synergy effect in certain areas, and we are not focusing our resources in treating serious cases. So for the measures I just announced today, they have fully incorporated views from mainland experts. I'm sure they have the recognition of Professor Liang as well. I now give the floor to Professor Chen to brief you on her interaction with Professor Liang and the experts.
Thank you, Chief Executive. Well, as the CM mentioned, there three groups of experts. The first group were experts on epidemiology and infection control. They came mostly from Guangdong province. But then on at the national level of infection control, they were involved as well. And then the second batch of experts were clinical experts. They've been working closely with the hospital authority. For the first batch of epidemiological experts that I mentioned just now, I had interactions with them, and then they also had communication with the Department of Health and the Center for Health Protection. And for the third batch of experts, the high-level group of experts, Professor Liang Wannian and his expert teams, since they arrived, they've been working non-stop. We've had at least 7 or 8 meetings with them. And also for the first batch of mainland experts of epidemiology, there was probably more discussion on treatment, and so with the hospital authority and the clinical experts were involved too. And then Professor Liang Wannian had meetings with us, he had exchanges with us, and he also visited different facilities. And he gave us much guidance in the process. He also studied our various data, like our information data system and data system, and also for the death cases, there was more in-depth analysis. And then there was also an assessment on the fifth wave of the epidemic in Hong Kong as a whole. So there have been much exchanges in these areas. Now, Professor Liang has been here for just a week, but even so, he's put forward suggestions for this stage of the epidemic. Now, because Omicron infection is raging wild, and we have seen a surge in infection cases, and the hospital authority system has been overloaded. So with limited resources, what can we do to set, and we need to set priorities, and these are suggestions he gave us. And then the free reductions, as Chief Executive mentioned, reducing infection, reducing serious cases, and reducing fatalities. This is now our very top priority. You heard the measures mentioned by Dr. Tony Koh and others, and so all these measures are geared towards reducing the free scenarios I mentioned. And also we need to focus our resources on 4 aspects. And with his guidance and suggestions, we have started work in that respect. Another priority is about the elderly. That's why the Chief Executive announced a series of measures just now on how we treat COVID patients, in particular have elderly patients. Now, we want to prevent mild cases from deteriorating into serious cases. So for elderly patients with some COVID, and not even for elderly who have not yet been infected, we need to give them more support to prevent infection and to treat their conditions so they stay mild. Now, we will continue to communicate with Professor Liang and his team. Now, I was involved in some of the meetings. He had actually many meetings with local experts. He and his team have heard the suggestions of local experts and the data analysis, and those meetings have been most beneficial to all parties. So we are still in discussion with Professor Liang and his team, and then we will continue to implement their suggestions and follow through their guidance. In the middle, the lady. I'm from Now TV. well, there's news that the universal testing is no longer a priority. So are you going to do that, and when? Now, some experts have suggested we should wait till the epidemic has eased before you take forward the test. So what is the position of the government? And if there's going to be universal testing, will there be lockdowns? Because now we don't want to have, different information going about, causing people to snatch up food and so on. Now, what is the view of Professor Liang and his team on universal testing? Is that view the same as that of local experts? And what are the roles played by local experts and the mainland experts? Now, Vice Premier Han Jiang criticized private hospitals for not admitting COVID patients. Would the government now ask private hospitals to admit COVID hospitals or COVID patients, or would you just ask them to provide support? So does it mean that the central authorities are not happy with the coordination effort in Hong Kong, and would that affect your chance of running for the CE post? Now, in this wave of epidemic, there is a high fatality rate, and we have seen cases that the elderly have tried to get an ambulance, but they waited a long time and still could not be admitted in hospital. With this series of measures, would the situation be improved? Thank you. 4 questions. Thank you. First, on the compulsory universal testing, it remains an exercise we are making plans for. But when we will do it, it depends on the development of the epidemic. We also have to consider when is the best time to do the testing for the exercise to be the most effective. But then we need to make other preparations first, otherwise there's no chance for us to launch the universal compulsory testing. So we are now working out the details. When we actually launch the exercise, we need to consider the locations, the manpower level, and the provisions and so on. And of course, we also have to see when is the best time to do the test for it to work the best. Well, there are 2 schools of thoughts there. One say that because now we're using rapid antigen tests on a massive scale now, so probably over 1 million tests are being done today, because I and principal officials have to do the tests every day. For those working in our office, most of them do the tests every day. So there is some massive use of our AT now, and that allows us to get a rather good grasp of the situation in Hong Kong. And now, of course, we have the reporting platform too. So if we talk about universal compulsory testing, maybe it's not just 1 test, maybe we need 2 or even 3 tests. Hopefully then, if there are still silent transmission chains or silent carriers, they could be identified and isolated. Then we could sever the transmission chains, and then Hong Kong could bring this wave of the epidemic to an end. Now, in February, I first suggested universal compulsory testing. That was on the 22nd of February. I said then the 5th wave of the epidemic hit us hard and fast, and hopefully it will also go away relatively rapidly. Now, at the end of November 2020, there was another wave of epidemic. It only ended in April 2021, so it was a total of 5 months, and some premises had to be closed for some 5 months. And now we started closing these premises on the 7th of January. So I hope the 5th wave of epidemic could end sooner than the 4th wave, and then we could go back to normal sooner. And with this target in mind, then a universal compulsory testing would be useful, because that means we will do testing in 1 exercise, and then we'll be able to identify the remaining cases for isolation. So that will help us. So we have to follow closely the development of the epidemic and decide when is the time to carry out the universal compulsory testing. But then this is a major exercise. We need a long lead time to make preparations. It can't be done overnight. Say, even if tomorrow would be the best time to do it, But if we are not adequately prepared, we have not done all the planning with all the details worked out and mobilize all the necessary resources in Macau, it will not be possible to do it, because we need hundreds of specimen collection points across the territory. So we need to check each location to see if it's suitable. It involves a lot of work. So we're still doing the planning and the preparation, but this is not our top priority now. As to when we do the test, we have to consider all the factors, and we have to consider the advice of the experts. And when we do actually do it, as I've explained before, we want the test to work well, and then we want the public to remain where they are before the they have negative test result. So that's the approach we adopt in restriction testing declaration exercises. But then if there is a need to restrict people's movement to a certain extent, that may help us. At the same time, we have to ensure that the essential operations in Hong Kong remain in place. And we've issued a press release as to what sort of essential operations we're referring to. For example, financial services, because they need to trade around the clock. And also there is need for essential supply of power. Public transportation cannot be stopped altogether too. And then we also talk about a large number of people who are involved in anti-epidemic effort. They cannot, stay at home. And then we also have to consider the day-to-day lives of the public. If we don't allow people to go out, and if there's no support for them, it's unacceptable. So from overseas experience in Singapore, the UK, or Melbourne in Australia, they still allow people to go out at certain periods of the day or for a certain number of times for them to buy their daily necessities. So we've made that very clear. It shouldn't cause any confusion, and people need not be too anxious. There's no need to panic. There's no need to snatch up supplies, because every day by sea, by land or air, or even by railway, there is a provision of fresh food to Hong Kong every day from the mainland. So we have enough to meet our day-to-day needs. What we don't have enough is manpower at the moment, because we're talking about a large number of people who have become confirmed cases. They need to be isolated, and that their close contacts need to be quarantined. That's why many companies and organizations don't have enough staff now working. Even in the government, there is a certain percentage of civil servants who cannot go to work. So the many have a shortage of manpower, and that is actually our biggest problem. Now, on the experts' views on universal testing, well, you might recall Professor Leung did say that this definitely works, because this is the a measure adopted on the mainland too. And in the past few years, that's what we've been doing. We've been doing massive tests so we could achieve early identification, isolation, and treatment. But then the timing is something we have to consider very carefully, because we're talking about a major exercise involving so much manpower and resources. We need to make sure that the exercise works as intended. So we won't do it just because we've said we'll do it, but we have to do it in a way that it really benefits our fight against the epidemic, and that will help us come out of the fifth wave of the epidemic. And then we will carry out this arduous task. Private hospitals have always been our partners. They have been working closely with hospital authorities in public-private collaborations to ease the pressure on the public hospital system. And private hospitals have about 5,000 beds. They don't take up the large market share. So there is unique niche for private hospitals. Usually they handle patients who don't stay too long. They just go in for an operation. They stay a few days and then they're discharged. The Secretary for Food and Health has been in communication with the private hospital associations and other bodies. They have been asked to help with admitting non-COVID patients so the hospital authority could focus their attention on treating COVID patients, in particular those in serious condition. Now, I had a video conference with them yesterday. It was very useful, and they were really positive in responding to our requests. But at the same time, they've told us about their manpower situation, because given the nature of private hospitals, they may not be able to meet all our requests. Now, we've put forward 4 requests. Firstly, we've asked them for beds, of course. Professor Chan has set a target for them to let us use half of their beds, but then they expressed they had difficulties at the conference because they didn't have enough manpower, so they couldn't operate all their beds. And also, they have their own patients too. And then if they need to treat COVID patients, they need to convert their wards, say to they need to have air filtration system. They need to improve their air exchange system and so on. But then, of course, if they are able to do it, these Chinese university hospitals are already starting to take care of patients. And what they have suggested is that we'll just give you so much service, not necessarily the number of beds, so that private hospitals could provide professional services, and then patients could leave public hospitals and go home for recuperation sooner. And that's why I've encouraged the hospital authority to liaise with private hospitals as soon as possible to see how they could help in the best way possible. And then we're also talking about community isolation and occasional care facilities for the elderly. There's a very positive response. You heard that yesterday 2 hospitals are already recruiting retired healthcare workers so that they could take up the management of indoor games hall for this purpose, and I'm grateful to them. Now, there are reports that they won't accept COVID patients when they see their patients with upper respiratory problems or signs of COVID, or if they have fever, then they would turn away these patients. They clarified yesterday that this never happened. They will still take care of these patients, but then they agree that we're also learning that too. If they've done something, they will have to tell people. They say they will be issuing press release, or they will accept interviews with media to explain that they are actually providing such services to the public. And finally, I've asked them to do more remote consultation, and they all agree they would do it. So on the whole, with mutual understanding and cooperation, we could further enhance the role of private hospitals in our fight against the epidemic.
Now, because of the magnitude of cases in this wave, there's been a lot of impact on the ambulance services of the Fire Services Department, and therefore the department can no longer fulfill its performance pledges. Still, life-saving is their mission. So what we can help FSD most, and in turn help A&E departments, will need the effort of the whole community. We have appealed to the public a number of times. If you are not too serious, even if you are a COVID patient, if your symptoms are mild, there is no need for you to attend an A&E department. We have lots of health information and dedicated clinics to serve you. If we can do away with unnecessary calls for ambulances and attendances at A&E department, then I think the situation you referred to can be greatly reduced. Once again, we need the concerted efforts of the community. We all walk an extra mile, and I'm sure the situation can be improved by setting up designated hospitals. Thank you. Speakers off mic. The speaker is not coming through. Can you pass on the microphone? I couldn't hear. I'd like to know whether the central authority is dissatisfied with our work against the epidemic in any way. And there were rumors that the CUT would be held in March. Are we going to do it or not? As I said, such a comprehensive CUT will depend on the trend of the epidemic. I wouldn't overlook the reality simply because I made certain statements, because the reality is to fight the epidemic and not to do as what the CE has said. Now, this is the 9th of February, and while I can't say no definitely here, but then if we are going to do it with the time confirmed, we will certainly announce as early as possible so that the public can participate and can anticipate what's going to happen during the period. Given that we don't have any time frame or specific date in mind, members of the public don't have to worry. The disruptions to their daily lives because of CUT, and they can then do away with what they have been doing recently. The central authority has always given us full support in this fight against the epidemic. The central authorities are very concerned about the development of the epidemic, and they'll do their utmost to support Hong Kong. We used to say that when there were natural disasters in the mainland, Hong Kong was always willing to support. This time, Hong Kong is in a plight, and the central authorities as well as cities and municipalities and provinces are most willing to support us. So the care and concern from the mainland will give us a strong impetus in combating the epidemic. Since we have a lot of reporters present, let's confine the number of questions to 2 so that more can have a chance. The lady at the back.
Good morning. A few questions from the SCMP.
Could you speak louder, please?
A few questions from the SCMP. So for the universal testing, as the schools are closed to facilitate the universal testing, is it unfair for them to lose the opportunity to go to school? Are the schools closed for nothing? And also for the QEH conversion, will other public hospitals be converted to designated hospital for COVID patients? And also for the daily figure, what's the daily figure for confirmed cases today? Have the cases figure peaked because of the launch of the RAT registration platform? If this is the case, what's the assessment from the Hong Kong government? Thank you.
I'll answer the first question and invite Dr. Koh to respond to your second question. As far as your third question is concerned, I don't have the answer because the first duty of the Center for Health Protection is to provide the figures to the public at the 4:30 press conference. I normally do not have the figures in advance, but I'm sure that they are still collating, analyzing, putting together the figures to ensure accuracy, especially now we have the self-declarations for the RAT positive cases. So you will have to wait for another 4.5 hours to get the daily figure, today's figures from the 4:30 press conference. About the first question, the interests of the child has been put very high on our priority in tackling the COVID-19 epidemic. So on this occasion, we are not denying or depriving the students of their learning opportunities. What we have done is we have advanced the summer holiday. So instead of having a summer holiday in July and August, they will shortly have the summer holiday now. I think some already started to have the summer holiday from the 7th of March, that is 2 days ago. And by next week, all the secondary, primary, kindergarten schools will have the summer holiday, so that after the Easter break, hopefully around 20th of April, we will be able to combat this fifth wave, and then kids could go back to school with the face-to-face learning. Because previously we'll just suspend the face-to-face learning replaced by online learning, regardless of the duration. But this time, exactly because we want to preserve the opportunities of the students to learn in a face-to-face environment, we have adjusted the school calendar. But in so doing, we have also respected the uniqueness of the international schools. So international schools will continue with their school calendar because of their special arrangements with their expatriate teachers and their parents during summer and so on. I invite Tony to talk about plans for other hospitals, if any.
Thank you, Chief Executive. We are aware that we have increasing number of COVID patients, and the number of patients affected in the fifth wave far exceeds what we have in the past. That's why we have an imminent need to increase our capacity and capability to take care of such patients. Two major actions we are in the pipeline. The first one, we are converting more of our wards into dedicated wards that can accept COVID patients. Our target is to aim at converting about 50% of all our inpatients general hospital beds to be able to accommodate COVID patients. The other major initiative is to arrange some hospitals to be designated hospitals. As most of you are already aware, we have earlier converted Tin Shui Wai Hospital as well as North Lantau Hospital into dedicated COVID patients hospital with a total capacity of 460 beds. And from today onwards, we will also proceed to convert Queen Elizabeth Hospital into a designated hospital to look after COVID patients. The aim of doing so is we hope by concentrating the COVID patients together, concentrating the expertise, the resources, and the management of such patients, we will be able to provide better clinical outcomes for the COVID patients. So in the coming few days, we are going to transfer the non-COVID patients that are currently in Queen Elizabeth Hospital to the different hospitals within the Kowloon Central Cluster, as well as to other hospital clusters and to private hospital as well. We estimate that around 380 patients will be transferred in the coming few days. At the same time, to facilitate QEH have the capability of taking up more COVID patients, we will, starting from today, diverting some of the ambulance that is those who are not really critical to other accident and emergency departments. We hope that we will be able to complete this whole operations by around the 13th of March, that is this Saturday, so that Queen Elizabeth will be able to function as the designated hospital to receive COVID patients. We are at the same time closely monitoring the development of the epidemic, the number of patients, the severity. So in the pipeline, we are also planning other hospitals to serve similar functions, some of which include hospitals in different clusters like Rottenji hospitals, Heaven Hope hospitals, Feng Ying hospitals, and also Kowloon hospitals. Of course, we will closely monitor the situation and dynamically mobilize the resources to cope with the increasing service demand.
係，我哋問多兩位記者嘅問題。
Questions from two more reporters on the front row at the end there. I'm from Hong Kong Economic Journal. I want to ask about universal compulsory testing. You said in February the test will go ahead in March, and you explain now you're still making plans. So do you expect the plans to be completed within this month? Is it possible that at the end you will only make plans for the universal compulsory testing, but it will not be carried out because maybe the fifth wave of the epidemic would ease, and then you would decide not to go ahead with the test? So what are the indicators in deciding whether to go ahead with the test. Now, the chief executive election will take place on the 8th of May, and then before that there will be the nomination period. So would you avoid this period to avoid, unfairness to candidates? Or is it possible that the election will be rescheduled further? Now, you say you're going to do a daily press briefing. Why do you want to chair the press briefing every day? And what sort of effect do you think that will achieve by you hosting the press briefing every day? Thank you. First, on the universal compulsory testing, we're still making the plans and working out the details. I don't think we'll stop because at each stage of the preparation we may have to move on to the next stage. For example, first we need to identify suitable locations for the specimen collection stations, and this task will have to go on because we need to go and check over hundreds of locations. And then we also have to work out the daily testing, the specimen collection capacity for us to do the test, and then we have to work out the transportation and the logistic for sending the specimens to laboratories, and could laboratories give us the results in 24 hours so we could achieve early isolation. Now, if we have some 30 to 50,000 new cases each day, we will never have enough isolation facilities, but still we want to have enough community isolation facilities, and as I mentioned before, we hope to have about 50,000 places. Because, for the second isolation facilities, that should be completed and be commissioned at the previous Santin shopping center. This is built by the central authorities. So everything is is being planned, and we're making all the preparations, and when the time is ready we will do the test. But then of course we need to have a comprehensive assessment based on various factors. It's not just a policy assessment. We have to look at the views of the experts and the development of the epidemic. At this point in time, no one could say as to whether we have reached the peak of the epidemic, because there are so many variables. For example, with the our rapid antigen test, how many new self-declared cases will we see each day? And then another question is speculative, that is for the deferred nomination period and election of the chief executive. What if the nomination period clashes with the tests? Well, I cannot really answer such a speculative question, but of course it is an important matter. With the election, I'm sure the central authorities will have certain views and directions on that. On the purpose of the daily press conference, we are fighting a battle now. I'm sure the public wants to know how the battle is going, and which factors may, affect the battle, and would there be any changes in our strategy, and would these changes affect people? For example, we are going to convert the Queen Elizabeth Hospital into a designated COVID hospital. That means for residents living in Kowloon Central, when they call, say, 999, they won't be sent to Queen Elizabeth but to other hospitals. So there is a need for timely and swift dissemination of information. In fact, I've been doing that in the past 2 years. And since the start of the fifth wave of the epidemic, the SL government has hosted 100 press briefings, including the 4:30 press briefings. And I personally hosted 20 press briefings. And then the other principal officials together hosted 20 briefings, and then the 4:30 press briefings held every day. So I'm leading this fight against the epidemic. So therefore, I am all too prepared to give an account to the public on the epidemic changes. I am duty bound to do that, and I will keep improving my skills in this and giving explanations, and hopefully then I could answer your questions in a precise manner. Now, for the 4:30 press briefing, is rather technical in nature. we have 2 representatives from the Center for Health Protection and the Hospital Authority to answer your questions. They're trying their very best, but then some of the questions may go beyond their scope of duties. For example, in the past few days, questions were asked of Dr. Albert Au about the universal compulsory testing. Now, he's not directly involved in that exercise, and he is not authority to give answers on behalf of the SL government. That's why I see the need for daily press conferences to be hosted by me. Of course, I've been doing many press conferences in recent weeks, but then if we have daily arrangement, so this is a forum for people to learn more about the latest situation in the epidemic. So apart from the 4:30 press conference, I plan to do the daily press conference at about 11 a.m. except on Tuesday when we have the Executive Council. You know, the Executive Council had to recess for 2 or 3 weeks. That's why there were no meeting with the press in the past few Tuesdays, but of course I met you twice when I attended various functions. For example, on the day when I welcomed Professor Liang to Hong Kong, and also I went to Law Wu to welcome the first batch, the first rail service carrying goods to Hong Kong. But I hope such high-level press conferences don't have to be held for a long time. Because, as I said, we will hold these press conferences until we triumph in this battle. So the sooner we triumph in the battle, the sooner we will stop the press conferences, and then you won't see me. And if you don't see me, that means we are back to normal. 2 more reporters, the gentleman at the far left. I'm from Mingpao. Mrs. Lam, I have 2 questions. There are many in the community who have been infected. So is your approach to first live with COVID before we achieve zero infection? On vaccination, now, which having referred to local studies and overseas studies, would you make an open appeal to the elderly to take the BioNTech vaccine as far as possible in the next few days? Why do elderly patients have to be isolated at home? Would it add to the burden of their carers, and would that increase the chance of cross-infection? That's the first question. Second question, many people have passed away, and for those who've lost their loved ones, what do you have to say to them? Thank you. First, vaccinating the elderly is a very top priority for us now. I've set a target some time ago. At the time I said in the next 2 weeks, we would like to mobilize all possible resources so that we could go to these 1,000+ homes and vaccinate elderly residents who have not been vaccinated but who are fit to do so. We hope to do so by the 18th of March, but of course that requires the concerted effort of all. And we need the cooperation of the residential care homes, so they allow our outreach teams to go there and vaccinate the elderly residents. Of course, there are many elderly people who live at home too, and so we are working out with some social welfare organizations to see how we could help elderly living in the community, in particular the singletons, to get vaccinated. So we proceed with this work. I mentioned too that we have oral medication arriving in Hong Kong with good efficacy, and if the elderly become infected, unfortunately, the oral medication will prevent the condition from deteriorating into a serious case or even resulting in death. So we are taking a multi-pronged approach to protect the elderly. Now, of course, there are elderly people who passed away because of COVID-19, very sad about that. So what we want to do is now to protect the elderly. And after the epidemic, we need to review many areas of our work. For example, Hong Kong is proud of, is ranking the world with the longest you know, we have the longest living population, and we need to review what needs to be done so we could take better care of our elderly. Thank you. That's the end of the press conference. Sorry. Yes?
我問題係
My question was many people already infected. Will you appeal to the elderly to be injected, to take the BioNTech vaccine? And are you going to live with the virus before we have the zero infection policy? Well, we give people the choice. And the outreaching teams have got doctors and nurses, and it depends on the environment. As we know, we have stricter requirement on the environment when it comes to BioNTech. So it's not for the CE to designate a particular vaccine, but for doctors and nurses to decide. I thought your question was just a comment. I think at this point it's pointless to argue whether we are living with the virus or trying to achieve a zero infection. But I can tell you 100% that we'll certainly not adopt this so-called lying down approach in tackling the pandemic. In other words, we're not going to be idle, and we won't just leave it as it is because there are so many infections. Every life is precious, so we will follow the instruction of presidency, will ensure the safety and health of everyone in Hong Kong. Any nation that put people first will have this demand. Hong Kong is an inalienable part of the Hong Kong PLC, the PLC, so we will follow the highest direction of the country in fighting this war. Thank you. So we'll meet you again tomorrow at 11 a.m.